About breathing and bracing during pregnancy and how that relates to the activities that you're doing. Now, we talked a lot about we want to avoid this hard doming and coning or tenting of the abdomen, where during transitional movements, sitting to standing, lying down, and getting up in bed, a lot of flexion of the trunk or lifting something really heavy, we don't want to create, again, that doming. And when we have that doming where that belly kind of pops out a bit, we want to palpate that. And if it feels really hard, like there's a lot of tension there, we want to avoid that activity, modify that activity with less weight, or again, just change it up, right? Now, bracing and having the ability to breathe appropriately is important for pelvic health in general, but very important during pregnancy. So if we want to perform an activity like lifting, it could be a laundry basket, it could be doing any of the exercises that you're currently doing, we want to inhale in that 360-degree manner, really moving those rib cages out, really, again, expanding through the back and also a bit through the belly. Exhaling, we want to think about drawing the two pointy hip bones together and then gently pulling that pubic bone up. Okay, so it's an inhale, exhale, belly should come up and in. And then we talked a lot about coordinated breathing. That's super important, especially just in general when we're lifting. If we're not lifting over our 70-80% of our 1 rep max, just in general when we're not pregnant. But during pregnancy, if you're lifting anything, it could be, again, a 10-pound dumbbell. It could be lifting, again, laundry basket, groceries, whatever it might be. We want to perform and start practicing a coordinating breathing pattern because we don't want to breath hold. We don't want to bear down. We don't want to strain our Valsalva. So what we'll do is I'll use the 10-pound dumbbell here as an example. I'll do like a little goblet squat here. So what we're going to do is we're going to inhale, exhale. I'm bracing my core a bit, but I can still breathe. I'm going to inhale as I come down into my squat. Exhale as I come back up. At this point during pregnancy as well, especially during second trimester, heading into the third trimester, we want to listen to our bodies. We don't want to have incontinence or do exercise or activities that create incontinence, pain, of course, whether it be low back pain, round ligament pain, whatever it might be. And we don't want any pelvic heaviness with the activities that we're doing. So those are indicators that we need to modify the exercise, the position, decrease the load. We also talk about how if folks are not doing a specific modality of exercise, like running, for example, pregnancy is not the best time to start training to be a runner, right? So we want to stick with the types of exercises that we've done. And certainly if you've never lifted weights before and they are prenatal and targeted exercises toward the trimester of pregnancy that you're in, that's totally fine. But now this is where we might modify the activities that we're doing. We might be decreasing load compared to what we used to lift. We might be swapping out barbell lifts for dumbbells or kettlebells. And again, listening to your body is key. If you have any questions, shoot us a message and we can certainly chat through that stuff.